Just a few words by way of introduction before we get into our conversation. Paul's the head of the Clinical Psychedelic Lab and a senior research fellow in the Department of Psychiatry at Monash University. He's played a central role in establishing the field of clinical psychedelic research in Australia and is the principal investigator on a program of psychedelic trials. He leads the country's largest most experienced group of psychedelic researchers and clinicians and collaborates with many international experts and organisations in the field. Together with clinical and industry colleagues, he co-founded Australia's first purpose-built psychedelic-assisted therapy clinic, and he's regularly invited to speak on psychedelic science for academia, peak medical bodies, industry and government. So welcome, Paul. It's great to be with you.
Thanks, Craig. Thanks to you and the Centre for inviting me. Looking forward to the chat.
Yeah, it's a pretty interesting and topical subject these days. There's a lot, it's a rapidly emerging field of research. But before we get to that sort of work that you're involved with, I always find it interesting to hear a bit about what leads somebody to wind up, following the path that they're following. How did you come to this sort of field of research and clinical practice?
Yeah, it's a question that I think I can trace back to very early days in my childhood, really. We all have these interests that kind of go way back, and then they manifest in various ways by hook or by crook. Sometimes there's a lot of hard work and focus. Sometimes there's good luck. Usually a combination of the two. If you start to fulfill some of the dreams that you've had, and for my part, I always, from a very young age, seemed to have some sort of fascination in what was possible in human consciousness. And so it's interesting that I'm talking with you at the Contemplative Centre, because my earliest memory, if I would answer this question, my earliest memory that is relevant here is me as a perhaps 8-year-old boy, staring with some sort of strange bewilderment at a black and white coffee table book of the ancient city of Lhasa, with Tibetan Buddhists with phenomenal headgear sitting in pose with their eyes closed. And I was little, so I don't think I could have really known what was happening there, but for some reason those images just intrigued me. They were like my superheroes, and I used to go back to that book quite often, and then started discovering other kinds of images that led me to pick up a meditation practice as a teen, a bit earlier than most, I suppose. And there began my kind of, voyage of discovery in altered states of consciousness, and fast forward many years, and I did a PhD in a depression lab that was focused on the varieties of altered state induction methods and what they might have in common subjectively, neurobiologically, and also why, whether there was a common factor with respect to alleviating, psychological distress. So I was very interested in all kinds of ways in which we can get into altered states, and there's a very wide variety of ways in which different people can get into states that look quite similar to one another. And while I was doing my PhD, this contemporary wave of psychedelic science was growing. It hadn't really reached the point where there was much public awareness of it, but I certainly tuned into what was happening probably around 2011, 2012. And so I guess my interest is, in the psychedelic space is manifold, but it's predicated on a much more basic interest in, the varieties of non-ordinary states of consciousness and their utility, I suppose, both for alleviating suffering and for providing new knowledge.
It's excuse me, it's interesting in itself, but when you say non-ordinary states of consciousness, what does that mean in relation to, say, what we would call our ordinary state of consciousness?
Yeah, it's a complex one to describe. When you dig into this notion of what's often called altered states of consciousness, One of the essential or necessary, although not sufficient elements, is that the backdrop of conscious awareness, what some people call consciousness itself or ipseity, gets modulated and altered. Now, this is often one of the most shocking things about a somebody's first psychedelic experience, because that backdrop or fabric of consciousness is pervasive and therefore invisible. Anything that's kind of consistently there all the time in all directions, you won't notice it. And under psychedelics, it modulates quite dramatically and quite quickly, and that can be quite shocking to feel disoriented in your experience. I suppose there are all kinds of ways in which more reflective elements can change. Obviously, you can have things like hallucinations, or you can have new perspectives on old problems, or a greater sense of empathy, or some shift in your emotionality. All of these things are possible. Sometimes in altered states of consciousness, they are more dramatic than the range that we would see in ordinary life. But I think one of the important things about altered states of consciousness is that this kind of backdrop of subjectivity itself, the kind of screen onto which all your reflective awareness is projected, is altered as well. And a lot of times people will describe that as shifts in sense of selfhood. So we typically are experiencing the world with quite clear boundaries around what is self and what is non-self. And under psychedelics, and certainly contemplative practice and other methods, the boundary between what is me and what is not me can modulate, shift, or go away entirely. That can be a very disorienting experience. That can be a very scary experience. That can be an unbelievably blissful experience. And that is one of the fundamental ways in which people will describe these altered state experiences. And indeed, what we think of as mystical type experiences kind of, are often associated with spiritual language or depictions, has this kind of core self-transcendent element to it, where fundamentally it is not about perceiving the world through the lens of a clearly defined single entity that is you, with all your needs and neuroses and anxiety.
Yeah, we'll come back and explore this in a bit more depth later on as well. But for this might seem like a reasonably basic kind of question, but I suspect it's not as simple as you might think. But when people talk about psychedelics, like, what is a psychedelic substance? What makes it psychedelic and different to some other substance that you might have that might change mood, like an antidepressant or something else? What's a psychedelic substance?
Yeah, it's a good question. So, people attempt to define and describe psychedelics in a whole lot of different ways. It's an ever-expanding umbrella term, and as with any kind of word or attempt to language something, as the term becomes more and more inclusive, so it becomes less and less useful. It's becoming very imprecise. People will describe what a psychedelic is often with reference to the type of chemical that we're talking about, but I typically don't think that's terribly useful. The most common drugs that we're talking about are compounds that have a serotonergic or a serotonin structure in their molecular shape, like psilocybin and DMT. These are called the tryptamines, serotonergic tryptamines. But then you have other compounds like the phenethylamines, which have a dopamine-like structure in their molecule. And these are compounds that could be what we'd call a classic psychedelic, like mescaline, but also a drug that until very recently wasn't thought of as a psychedelic, like MDMA, the compound found in ecstasy. The way that I think is most useful to understand psychedelics is with reference to the etymology of the word psychedelic, which means to manifest your mind. The notion there is that there are aspects of your experience or your mind that you're typically unaware of, and it is possible under these drug occasioned experiences to have something of your mind manifest to you. Some people take a less kind of psychological interpretation. The ancient Greek doesn't necessarily refer to mind. It could be soul or spirit or something like that. And so, these drugs are, firstly, they are drugs. I would say when they are psychedelic, they they bring about a sense of new perspective or knowledge that you feel is reliable or represents the world or represents yourself, is truthful, and that is not discounted as a drug-induced delusion. Like it has an enduring authority over time. Now, many compounds induce an altered perspective and an altered state of consciousness. Getting drunk is a kind of altered state of consciousness. But under psychedelics, something very different happens. A lot of people will describe something that feels like waking up out of the dream of your life, which is not dissimilar to what a lot of people describe in deep meditation practices. Like you're more sober than you've ever been before, and you're getting a wider or more healthy perspective on yourself or the world. And the next day or the next month or the next year, you still store confidence in those perspectives. It's worth saying, the common experience under, well-controlled supportive psychedelics includes that, and also alongside a sense that there are intoxications and aberrations going on at the same time. So people don't typically come out of it and go, well, actually, in reality, the walls are bended and there's rainbows around the edges of things. We know that these are perceptual distortions and they've got neurobiological bases, but it's quite phenomenal that in the context of all these distortions and shifts and changes that we don't necessarily attribute to having a great deal of meaning or accuracy, we can still have these experiences that feel like knowledge or useful new perspectives or an alignment to your priorities. And yes, that's a very long-winded answer to a simple question. What is a psychedelic? But psychedelics are these compounds that bring about useful new perspectives or knowledge. Yeah.
Well, simple questions are often not so simple. And as you say, the way things are defined and redefined and how it shifts, it's not always easy. But so they aren't necessarily hallucinogenics, although from what you were saying before, they can do.
Right. Yeah. So yeah, actually, we've discarded the term hallucinogen for the most part and replaced it with psychedelic. In the first wave, 50s, 60s, 70s, hallucinogen was a more common term. Actually, you don't get bona fide hallucination with a lot of the psychedelics. You do with something like NN-DMT, something like psilocybin. No, you'll have a kind of visionary state experience, a lot of visionary experience with eyes closed, but you can tell that these visions are not actually manifest in physical reality in front of you, which is what a hallucination would be. So, but in general, anyway, the kind of perceptual shifts and changes are often considered among the more trivial changes. It's what they mean. It's the layers of meaning. It's the new perspectives that seem to be more important.
So this sort of field got a bit of bad press, I suppose, from the excesses of the 60s and 70s. It must have been quite challenging to sort of come back from that and for it to become a much more serious and respected field of science. And I suspect that the way in which you use them now is very different to the very high doses that people were taking then. So it's quite a different kind of experience that perhaps would have been the stereotypical notion people would have had of the use of these substances from the past.
Yeah, maybe yes and no. I think so. So the history of psychedelics in the West is complex, and yes, while we're all very aware of the excesses of the 60s and 70s and people like Tim Leary, who was met with a lot of fear and consternation and ultimately resulting in the Nixon administration's war on drugs and so on. That's one piece of the story. There were a whole set of other elements too. You had early, Western explorers in the late 1800s exploring with psychedelic compounds and indigenous practices. You had quite a lot of interaction with indigenous and Western practices in the 50s as well. And there was a lot of what was done in clinic with psychedelics in the 60s and 70s and in some of the research trials has a lot of overlap with what we do now. In fact, yeah, there were some trials where they used excessive doses, but generally not. In fact, we in our lab here and in about 100 labs around the world now typically use what we call high dose psychedelics as part of our treatment. It's more in general more controlled and more manualized what we do all around it. There's a lot of preparation and work afterwards, and a whole set of protocols that hold it quite tightly around the dosing session. But there's a lot in common with what was done in that first wave and what we're doing now. Although, yeah, certainly nobody wants to replicate the kind of the messiness and the ways in which psychedelic utility got conflated across a whole set of different domains. Now we're using psychedelics as alongside therapy as a new experimental treatment for psychiatric issues and addiction issues and so on. We're also now moving out of psychiatric populations into other potential use cases. This is entirely different than, say, cultural practices that started to take hold through the 70s, or recreational uses, which I don't want to derogate, or indigenous uses, or cognitive liberty motivations. I think it's really important to draw a bright line in the sand between the kinds of uses that we are developing and delivering in a clinical scientific context from all the other potential ways in which psychedelics could be used. There's a lot of work in harm minimization around drug use in naturalistic settings. Valuable work. It's just not the same as developing and testing new forms of mental health treatment.
Because many of these substances, in fact, most of them are naturally occurring substances, and they have a very long history of use. If you went back hundreds of years, maybe even thousands of years, what was the context in which people were using these kinds of substances then? What were they looking for? What was, when they were used in those sort of cultural contexts?
Yeah. Look, there's a very long historic record of psychedelic plant use across different civilizations of the world, from, the Mesoamericas through to Siberia. And probably for many thousands of years. Some cultures, quite a few cultures actually have the psychedelic practices at the heart of their cultural practice. And the kind of motivations are varied. There is certainly the kind of healing. And in many indigenous practices, psychedelics were not only used to heal psychological ailments, but were used to heal physical ailments and spiritual ailments and interactional ailments. But then there are also, use cases around divinity and witchcraft. Psychedelics have even been shown to be used in hunting, augmenting perceptual senses, in warfare. It certainly wasn't all, this rosy-colored, holistic approach to using plant-based medicines and the like across indigenous societies around the world. Is complicated. And often they were a central kind of practice and sacrament and technology. In some cases, you had the patient consuming the psychoactive compound. In other situations, only the doctor does. Yeah, very, very wide variety of use cases, and now in contemporary Western psychedelic science, we also have quite a diverse set of use cases, and it's branching out again, going from these more clinical applications of very severe intractable psychiatric conditions through to all the ways in which psychedelics may augment things like creativity and innovation, may augment practices like mindfulness. And in our lab, we're using psychedelics in the training of professionals, of therapists that work in the space. And soon, hopefully, we'll be starting a project that'll utilize psychedelic alongside a whole other program to address group-based polarization towards social cohesion and the like. So there's many projects around the world that are really showing, the diverse applications of these compounds and what they can do. Yeah.
Because you're one of the trials you've got at the moment is using psilocybin in the treatment of primary anxiety, and I'd just be interested, like with a lot of the medications that are used to treat anxiety, there's a sort of a numbing, a kind of of one's experience and perceptions to some extent with a sedative and so on. And this seems to be, as you're saying before, a kind of a increased level of awareness. How is it that something like one of these substances can have a therapeutic effect for, say, anxiety?
Yeah.
Is it just that the person's perspective changes for a moment and all of a sudden they see the things they were anxious about before as, there's no cause for anxiety? Or is there a chemical change that is enduring after the use of the medication that switches? Or how does it work, Paul?
Yeah, it's a great question. It's a tough question to answer. I can come at it from a few angles, but the most powerful level of explanation, in my view, with psychedelics is to do with subjective experience, what people actually go through during their trip session, and then what they make of it afterwards, and how that's all supported. It is, as you say, it is entirely different than other psychiatric medication in its motivation and in its use case. So psychiatric medication it's focused on clipping certain aversive experiences, mood and anxiety and so on. With psychedelics, at least in the short term, it's almost the opposite. We're attempting to bring about a greater sense of contact with the fundamental sources of your distress in a supportive context. In some ways, there's a lot in common with some of the motivations and effects of contemplative and mindful practice. What this is kind of predicated on, in my view, is the notion that psychopathology, like the kind of dysfunction that we can all experience, is born out of avoidance, like a set of coping mechanisms, you might call them defenses, that are all about avoiding certain kinds of difficult experiences, memories, whatever they may be. Now, the human condition entails suffering and stress, and the psychedelic approach is not about saying, we want to do away with suffering and distress. In fact, it's about shifting our relationship to that suffering and distress from one of avoidance to one of curiosity, openness, acceptance, etc. So in that way, it's very similar to a lot of contemplative practice. And one of the key advantages with psychedelics is that these compounds, in different ways, just put rocket fuel on that intention. You might have that intention in meditation, for example, or in some other practice, maybe in psychotherapy, but it can be very hard to step yourself over that cliff edge. You just stop at the cliff and, the coping mechanism kicks back in, and, that can be fine. It can be helpful and useful to move slowly and pendulate into, a greater kind of tolerance of what is going on for you. But with psychedelics, you kind of, you do this preparatory work where you build trust in, the context in your mind, in the people around you, and so on. And then you buckle up and you get blasted into the stratosphere. And it's an incredible advantage because, it's like this old saying that it's very hard to scaffold your way out of an issue using exactly the same infrastructure that builds the issue in the first place, namely, your thoughts and your words and your mind and your fear around your own survival or your status or whatever it is. So psychedelics allow you that opportunity to get a leg up, a bit of assistance in that process. And then, people will have all kinds of different experiences. I mean, the varieties of psychedelic experience are phenomenal, but there is very often, firstly, this recognition of aspects of your experience or your history that you have neglected or done something strange to avoid it. and potentially some acceptance around that, or just maybe less fear. People who have a terminal diagnosis and have psilocybin treatment will often report something that feels like a dress rehearsal of their own death. They'll go through the other side. They'll realize it's not so bad over here. In fact, that was rather fascinating. And then they'll come back without a fear of death. And that's very useful. But also often people will feel realigned to their priorities. They'll like wake up to what's important, and will sometimes get genuinely new knowledge, like a new perspective on themselves. Maybe it's through radical empathy, seeing yourself through somebody else's eyes. Maybe it's seeing some part of yourself in a new way. And that new information comes in a deeply felt way and can kind of motivate you to change. Now, you mentioned something interesting there, is it the drug that has this kind of lasting effect? No, the half-life of a lot of these drugs is a few hours. Psilocybin is like 6 hours. So certainly a couple of days later, there's no psilocybin left in your system. And so how is it possible that 6 months later, or even 6 years later, people can feel the lasting benefit, and we can measure that, of a single psilocybin session? Well, my sense there is that through these new perspectives and these new experiences that are deeply felt, people feel motivated to behave differently and to do things differently. They enter a virtuous cycle of learning, which is often reciprocated by the relationships in their lives or the things in their lives. And that virtuous cycle is what leads to the potential durable benefits. Yeah.
One of the really crucial things that happens when, say, using mindfulness to help people with depression, anxiety, etc. And many of us who might have practiced these things may well have had these sort of moments of insight for ourselves. But you just get a sense of all of a sudden seeing and realizing that the thoughts are coming and going, feelings are coming and going, moods, etc., coming and going. But you get a sense that there's a you underneath that. There's a kind of a watching of that. Normally identify ourselves very strongly with those thoughts, feelings, moods, attitudes, etc., and get very caught up in them. But all of a sudden you get a sense, oh, that's not me. I'm just the watcher of them. They come and go, but there's something in me that remains, which is kind of very stabilizing experience. And it often seems that when people have an experience like a moment of insight like that, the stuff never quite catches in the same way. It never quite disturbs in the same way. We realize, yes, it's coming and going, but like everything else, it's going to come and go. There's a kind of a stabilizing effect. Is that part of what can happen, like that just sort of insight opens up in the use of some of these psychedelic substances?
Yeah, it can. It often doesn't look like that unless somebody's got a mindful practice or is inclined in that way. It'll often look more like what we call the overview effect that astronauts report. You'll hear this from the few lucky souls who have managed to get into outer orbit and look back on the Earth, put everybody they love and all of human history behind their thumb on planet Earth, and recognize, oh God, like the universe is wide, is so wide, and there we are caught up in the trivial, the relatively trivial perturbations as though they are tidal waves. And I think a lot of people under psychedelics will have that kind of experience, like, wow, what's possible in human consciousness is so wide and so awe-inspiring that the things that I tend to occupy myself with, whether they are, anxious or neurotic or just trivial or banal, are small. They are just that. So I think that's part of it, can give you that kind of big perspective. I think there definitely is something that can remain for people when you've had an experience of self-transcendence, losing yourself, what some people in our field call ego dissolution. It can serve a similar function to what you're describing, I think, with contemplative practice, where the sense of you being a fixed entity and having your needs becomes a little more transparent. You get to look through it and go, yeah, that's something I do. It's not just a background fact of reality. It gives you just a bit more wiggle room once you've seen that you are not quite as consistent and bounded and persistent as you like to think. Yeah.
Well, and I'd be interested to hear more from somebody who's really up with all the science in this area. But I believe one of the areas that psychedelics can affect in the brain is the default mode network, which is one of the areas that seems to, when it's just running off by itself with worry and rumination and so on, is very much associated with anxiety and depression. It seems like mindfulness practices too help to sort of switch down or down regulate that whole default mode network of the internal chatter and commentary and judging and criticizing.
Yeah.
Is at least part of the mechanism on a neurological basis to do with that default mode network. There may be other mechanisms as well. That sort of when that settles down, people often have a sense of that sort of the ego, the self kind of expanding to some extent.
Yeah. So there are a few kind of key neurobiological findings in the psychedelic space. Some of them are highly overlapping with what's been found in mindfulness brain imaging. And one of them is what you describe, a down regulation or in terms of functionality of this default structure, this kind of set of structures in the medial, mostly medial part of the brain that is our natural kind of default way of processing the world and tends to instantiate a lot of self-reference. Like either it's thinking about yourself or thinking about how the thing in front of you is relevant to you. Is it good or bad for you, and so on. And that hub structure is very dominant. And so when you quieten it down, you have this disinhibition that happens in the brain where other structures that are inhibited by it can light up. And one of the ways that I think about this is with reference to Huxley's famous reducing valve. Aldous Huxley had this famous analogy describing the brain as a reducing valve, which is borne out through neuroscience over the last 30 years. Most of your brain has inhibitory neurons. Most of what your brain is doing is inhibiting other parts of your brain. That's useful because it allows you to specialize and achieve specialist kind of outcomes in the moment. But all of that serves the function of your survival. And so you're kind of seeing the world, you're more than seeing the world, you're predicting and creating the world in a manner that is relevant to your survival. Now, you and I are fortunate enough to not have to worry about our bodily survival much of the time, but we do worry about other things like our status survival or the like, which are analogous. And so the way that I think about Huxley's reducing valve is that the constraint feels like anxiety, and it can feel like anxiety in a very subtle way. In fact, a lot of people will describe that when they had their first MDMA session, they realized that they were anxious all the time prior to that, even though they felt they were well. That there's this backdrop of anxiety, which is, just what we think of as normal, and it's basically it helps us constrain our focus to what's relevant to our survival. Under psychedelics, that aperture blasts open in a few different possible ways, and that can look like the default mode network quietening down. One of the things that happens much more in psychedelics than in mindfulness brain changes seems to be very intensive long-distance connectivity among structures that are typically in opposition to one another. So you have structures that are what are called anti-correlated. When one lights up, it inhibits the other, and that goes down, and vice versa. They are really competitive. And under psychedelics, these very distant circuitry that typically are not lit up at the same time, light up at the same time, causes a degree of chaos as well, and it reduces functionality. You can't drive a car, you can't play with your kids, you can't do things that you don't know what time it is, you don't know what's socially normative. But these structures that are lighting up at the same time include high cortical cognitive structures and deep limbic emotional structures. So this kind of ability to have a new insight or perspective on something that's kind of unusual. You're joining dots that you haven't joined before, and you feel it in a remarkable way. So lots of commonalities there with mindfulness, and then a few possible distinctions or shifts in emphasis with psychedelics.
So they seem to be having, and there's a little way off before the sort of what mainstream use of these. And I know you in your clinic, there's a lot of scaffolding of these practices and support. You know, somebody's got to understand what they're doing and why they're doing it, rather than just being thrown in and given the drug, etc. So a lot of scaffolding and support. When afterwards, a person might have had a different perspective on things for a while. What happens after the event? Does the person have insights that really do change the way that they live or see things or decisions they make in life? Or is it just an experience that comes and goes and there's just a residual, settling and so on? Does it really change things for people?
These are good empirical questions, and our group and others are really focused in on what are the factors that lead to durable benefit. Because we can now, with our protocols and our training and so on, we can pretty reliably get very safe dosing sessions underway. We can pretty reliably give people one of the most personally phenomenal, profound, sometimes challenging experiences of their lives. That's quite reliable. What's more variable and more difficult is how do we ensure that this high burden, high cost, intensive intervention has benefit that lasts for many years, because that's what you'd want to see. That's what would make it worth it. And certainly we are seeing the beginning signs of it in naturalistic studies and some controlled studies. We're digging into this now. People do change their behavior, and you'll often see a direct relationship between how close or inspired to their psychedelic insight they continue to feel. To what degree does that still feel generative and have a kind of affective quality? To what degree have new practices been instantiated and bedded down? You have this kind of what's called an afterglow period, maybe a few weeks after classic psychedelics, where people will often start to do things differently, and if they can maintain those new practices like mindfulness, that can have very, very realizable benefit in their mental health. And we definitely are seeing like the beginnings of a link between what people experienced during their psychedelic session and the changes they make in their lives and how that is good for them. But it's early days understanding how to get these durable outcomes. I definitely feel that, there's already the beginnings of work in the space around practical synergy between mindful practice and classic psychedelics. And this is one example where I think there's a potential role there for mindfulness. We wrote a paper, some colleagues and I wrote a paper some years ago, trying to articulate a perspective that I've had for some time, that psychedelics for a lot of people represent a remarkable compass. Like it sets your course, aligns to your priorities, motivates you. But for a lot of people, they're not a great vehicle. They don't kind of bed down the change and bring that into like your traits. And mindfulness is often for a lot of people a fantastic vehicle, but a lot of people will practice mindfulness and just, recycle their neuroses, even exacerbate them. It can be quite hard getting out of your default way of operating, even when you do mindfulness. And so for some people, I think there can be a lot of benefit in setting up, changes in your life through psychedelic experience and then maintaining them through mindful practice. Of course, there are other potential synergies, and there's already been a few studies that have combined mindfulness and psychedelics to show other potential synergies between the two. But I do think there's a fantastic fit.
Yeah. No, I'm conscious that we've got a number of questions that are coming in, and Jess, you've been looking over those, and we might, if you're happy, Paul, see if we can see what some of those questions are.
Jump straight in here from Tracy. She's asking, so we've talked about the depression, or how the psychedelics can assist with depression and anxiety. Have you used psychedelics with people going through extended grief, or any research on that?
Yes, so actually, there were a few people in our now completed psilocybin for anxiety study that were experiencing extended grief, but more pertinently, there was a study done up at QIMR in Brisbane that hasn't been published yet, but just completed, headed up by Vanessa Beasley, that was using psilocybin specifically in prolonged grief or bereavement. And we heard them present at a conference recently, and it was a very early, small pilot study, but very positive signal there for sure. Yeah.
Are there comparative studies on different neurological populations, for example, ADHD or autism spectrum, rather than studying the effects on different traumas or mental health issues?
There probably are some survey-based studies. I'm not aware of any kind of empirical drug trials that have done that. Although, while we and other groups around the world typically exclude a set of psychiatric and neurological conditions by default, and often out of an abundance of caution, not because we know they're contraindicated, we're often including a whole set of other issues or neurodivergence. So, on our trial with just over 70 people with severe anxiety, we had about 10 or a little bit over 10 who had ADHD or autism spectrum disorder diagnosis or neurodivergent. We haven't dug into the details there around differences across these subpopulations. And I'm not aware of a great deal of research other than some survey studies looking at that. But it's definitely a new frontier looking at psychedelics in neurodivergence.
Next one we have is very interesting. Thank you, Paul. I'm curious to know how many enthusiastic participants in your studies you have, given that many of us are uncomfortable stepping outside of these defenses that have taken a lifetime to form.
Is the question, I'm unsure what is meant by enthusiastic in that context. As in just the number of people that want access to these studies, is that what it looks like?
That's how I'm interpreting it. How many are enthusiastic about participating? They've had a lifetime to form.
Yeah, sure. Okay, well, there's an interesting kind of combination here. Like, yes, massive demand. We have thousands of applicants to our studies for sure, probably because people are desperate and there's a lot of unmet need out there, and a lot of treatments fail and are just underwhelming. There's also a lot of hype and interest in psychedelics. Some of the hype is really problematic for us. Particularly not just the hype, but some of the kind of misunderstandings that come with the hype. The notion that this is primarily a drug-based treatment, that it's primarily passive, that you're going to get fixed, or that's problematic. Of course, there's a ton of potential here, and there's reason for people to be excited. But so we'll have a lot of interest and a lot of people trying to get in. We've got very rigorous screening, and the funneling down is intense. Only about 5% of applicants make it into our trials. But then, of course, when people arrive into the trial and are approaching their dosing day, there is a lot of anxiety, absolutely. So far, we haven't had a runner, but we've had a few people who we've had to kind of talk back into the room to just say, yeah, this is going to be good for you, or we're going to support this. So, yeah, I think even for well people, a high-dose classic psychedelic is a potential confrontation, potentially extremely challenging. But there are techniques and skills that are reliably protective. It's not like rolling a dice.
I just wondered too whether there are particular predisposing factors of openness, of curiosity, of ability to regulate emotions and so on that can help a person to move through in a very constructive way what could otherwise be a challenging experience.
Yep, no, absolutely. There are individual factors, and then there's also skill development. And we do a rapid version of skill development in our preparatory phase prior to the dosing sessions. But there are other studies that have shown, again, back to mindful practice, that people with a mindful practice have less kind of anxious, avoidant response to the psychedelic trip, and have, more deep, profound, mystical type experience. So being able to sit with discomfort, being able to pay attention plainly to what is manifesting in the moment, having patience, having equanimity, these are highly protective. But we do something that's a little different in our preparatory phase that attempts to bring about a greater sense of trust, which is our primary virtue during the prep phase.
Perhaps last question. Yes.
Yeah, no, you've answered another one, so that's good. You answered two in one there. This one's from Jason. Is it possible to replicate such profound perspectives alongside our normal psychosocial development from childhood to adulthood without psychedelics? Or are psychedelic experiences unique in augmenting the human experience?
Yeah, look, my view would be that by all means, incredibly profound personal experiences that can have transformative potential can be found in a variety of ways. I don't think they are all just the same, and they just look and feel the same and do the same thing. So I think psychedelics in different psychedelic compounds and in different interactional combinations with the context can bring about unique elements, if you like. It's just that psychedelics, if they're well held and supported, as we've kind of bedded down in reasonably straightforward clinical manuals, are the most reliable, rapid way to achieve these kinds of states and these kinds of opportunities. The vast majority of people can experience phenomenal, profound, new and useful perspectives within a couple of hours of getting started, which is not what could be said about almost any other induction method. I just wanted to add one little piece because I saw a question about supporting our research, and I just wanted to flag to anybody listening on the call, if you're interested more in what we're doing, you can just go to monash.edu/psychedelics. There are ways to support what we're doing for sure, and to be involved in what we're doing, you can reach out to us at psychedelics@monash.edu. And also, if anyone wants a little bit of a window into what these trials look like and what psychedelic dosing sessions look like, then you can watch a feature-length documentary on SBS called Stepping into the Unknown, which focused on our group and a few of our very courageous participants that let the camera into their lives and into their dosing sessions, and gives quite an insight into the process.
Great. I'll pop that in the recording, actually. That might be as added.
Fantastic. Thank you so much, Paul. Look, I think we've hardly scratched the surface, and but it's been fascinating, and this is perhaps a whole new horizon of research and clinical practice, which I'm sure many people will watch with great interest. So thank you, and thank you, Jess, once again for doing everything in the background to set this up and do such a wonderful job with that. And we look forward to being with everybody first Thursday of the month, 12 o'clock. We'll be speaking to Amishi Jha, who's one of the world's leading contemplative neuroscientists, and she's going to tell us all about the management of attention and what the science can tell us about that, as well as the practice of it. So we look forward to everybody's company next time.
Thank you so much, everybody. Thanks.